Hey guys! This video today is going to be about my birth plan. I figured now that I am in my third trimester, this would be a good time to finalize everything with my birth plan and share it with you. So I know not everybody does a birth plan and not everybody feels that they're necessary. For me, I think it really helps get all of my thoughts and feelings about how I want my birth to go together. And it also helps communicate my wishes to the hospital and the nursing staff on hand. Sometimes when you go in, you're not in the right frame of mind to remember necessarily everything or to effectively communicate. So having a written out birth plan for me really helps. I am going to do a video on how to create a birth plan. I know, especially for first-time moms, it can be really confusing and overwhelming and you just don't know where to start. With my first daughter, I had no idea what to do. I basically just got one of those checklist fill-in-the-blank worksheets and I did it that way. Very generic, very unpersonalized. And you really don't learn a lot. You're just like checking things off or filling in a word here or there. So with my last child, I really educated myself and found a lot of resources on how to create good, effective birth plans. So I will do a video on that. But this is how mine is set up. Super simple, straight to the point. Not very long or detailed. I have some main categories with bullets underneath it. This makes it really quick for the hospital staff to look at and to get the idea of what I'm trying to say. And you're not spending a whole bunch of time trying to read through things. It's just straight, simple, to the point. And as always, if you guys have any questions about any of the things I put in my birth plan, please let me know. I would love to discuss it more or answer any questions you guys might have. But I guess I'm just going to get right into it. So my first section has to do with the birthing environment. And I just have two things under there. One is to please keep the lights as dim as possible. I don't need a whole bunch of spotlights shining down on me, making me feel like I'm in the spotlight. I just want to be able to relax. And the other one is that we would like to use aromatherapy during labor, meaning that I will be bringing some essential oils and things with me, and I intend to use those. My next section has to do with first stage labor. And my big one up top is I would like to be able to eat and drink during labor as I see necessary. A big thing when you're in labor and you go into the hospital is they don't want to give you food or drink. Maybe if you're lucky you might get water, but it's generally ice chips that they just want you to suck on. Now, this is something that I completely disagree with. I understand if you're having a C-section or maybe if you're high risk for a possible C-section. I understand that they don't want food in there. But if you are having a normal, low-risk pregnancy, I really don't understand the whole no eating or drinking. You could be in labor for a lot longer than what you anticipate, and you need to keep your energy up. Being denied food and fluid is not going to help you keep your energy up. My first child, I was in there 26 hours. After 26 hours of not being able to eat, not only was I angry, but I was sick to my stomach. Like, I literally got sick. And I actually got sick with my second one as well. And I really feel like that is because they wouldn't allow me to eat, because I am the type of person that needs to eat every couple hours or I will get sick. So that's my big one. My next one is please do not offer chemical pain relief. If I need it, I will request it. I am planning a natural birth and I just don't want nurses coming in constantly asking me if I need pain medication or if I'm ready for an epidural or blah blah blah. I just want to put it out there that I just don't want them to bring it up. Then my other one is I'd like to move around as freely as much as possible, meaning I don't want to be hooked up to a blood pressure cuff, to an IV, to anything that is not necessary. I just want to have the freedom to move around. And I did do that with my last one. So, and the last one is I'd like to utilize the tub or shower and birthing ball when possible. Now, at our hospital, we have one room with a hydrotherapy tub, and I am praying to God that when I go into labor and we go to check in, that room is open, because I would love to try out water birth. Had not gotten to do that with my last two. If not, then I will just like to utilize the shower, because being in water is very relaxing and relieves tension. In the birthing ball, I spent most of my last labor on the birthing ball, so that was very helpful. My next section has to deal with second stage labor. And my first thing I have is I would like to use a hot compress or warm washcloth to limit the possibility of a tear. I don't want an episiotomy. I have torn with my last two children, and I never used a compress or washcloth to try to loosen that area. And I'll tell you, after tearing twice, the first one was pretty bad. The scar tissue hurt, and I could feel it for years. Years and years. If I touched the area, I could just feel where that scar tissue was. So right now I just want to do whatever I can to limit that chance of it happening again. My next one is I would like to use mother-directed pushing with encouragement from others in the room. And by that, I mean I don't want a doctor to come in and say, okay, it's time to push and you're going to count to 10. And no, that is not what I want to do. I've never done that. I've always had a midwife, and they've always been really good about gently leading or helping or encouraging, but never that like, okay, push and, keep pushing for 10 counts. And I don't want someone to be really pushy with me, because I feel like I've done this twice. That doesn't make me an expert, but my body, I feel like, knows what it needs to do. So I just kind of want to go with that at my own pace. And then my last one is I would like to utilize different birthing positions, meaning I don't want to only be on my back, is what you typically see with like on TV or whatever with birthing moms. Being on your back is not necessarily the optimal position to help baby come into the world. One that I think I would feel comfortable with doing is squatting. When you're squatting, your pelvis opens up, and that is something, and also gravity helps baby come down. And you can use something like a birthing stool or a birthing bar or squat bar, whatever you want to call that, to help you hold that position. So that's something that I think I want to try. And there's also being on your hands and knees. I don't know how comfortable I would be like that, but I know that there are a lot of women that do utilize that position. My next section is difficult or unexpected situations. And the first thing I have under there is I would like the opportunity to accept or refuse any procedure unless there is a true extreme emergency. Meaning, I just don't want someone, like if labor stalls, I just don't want someone coming in saying, okay, we're hooking you up to this and we're going to give you this drug. I would like the opportunity to try other methods, or to at least be involved in that choice, unless there's an extreme emergency where they're wheeling me down the hall to cut me open and give me an emergency C-section. I understand in that situation, my voice is not going to really matter. But in any other circumstance, I would like to have a say-so. And that brings me to the next one. If labor has stalled, I would like the option to try other methods before chemical medications. There are a lot of different methods you can try before just being given drugs to try to increase contractions and such. So, and then my last one is if a C-section is necessary, I would like for the dad and doula to be present and for myself to be able to have immediate contact with baby if possible. And then my last section has to do with post-birth or newborn care. And my first one is that we would like for dad to be able to catch the baby and cut the cord. With our last daughter, my husband, once she crowned and her head was out, my husband delivered her the rest of the way and of course took care of the cord. So he would like to do that again. And then as for the cord, we want to wait to clamp it until it is done pulsating. And then also I want immediate skin to skin contact and to be able to breastfeed immediately. And then also that we prefer to hold off on the newborn checkup for at least an hour. So we want to have the ability to just have her come straight to me to nurse, just to have that bonding time without her being whisked away over to the scale to be weighed and measured and all of that stuff. And then the last one is we prefer for all checks on baby to be done with both of us or one of us present. And the reason I put that in there is because with my first daughter, they never really told me anything that they were doing. For instance, they gave her her first bath and I had no idea that it was going to happen, and it was something that I wanted to be around for, but I didn't get the opportunity because nobody even told me that they were going to do it. So I put that in there just because, you know, there are some things that I don't want to miss out on. So I just feel the need to make sure the hospital staff knows to please not do anything without letting us know and without giving us the opportunity to be there and at least watch if that's what we choose to do. So that is the gist of my birth plan. If you guys have any questions or comments, feel free to leave them below. I like to hear from you and I like to interact with you guys. So I guess that's about it for now. Thank you so much for watching, and I will see you guys later. Bye.